Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain Usher syndrome. ENT and ophthalmology have their links. The eyes are anatomically closely positioned to the ears, nose, and the throat. And these organs are also innervated with various cranial nerves. Eyes with the cranial nerve 2, 3, 4, and 6. Ears with the cranial nerve 8 for balance and hearing. Nose with the nerve 1. And throat with the cranial nerves 9 and 10. So, Usher syndrome is a disease that demonstrates this link between ophthalmology and ENT, and this is a condition related to sensory neural hearing loss plus retinal dystrophy. Usher syndrome is an autosomal recessive syndrome, and it is related to the congenital hearing loss and retinitis pigmentosa, which is an accumulation of pigments on the surface of the retina. There are 4 types of Usher syndrome, type 1 being congenital deafness plus the lack of vestibular function. So this will result in ataxia and visual loss by the first 10 years of life. The second type is a later onset hearing loss and normal vestibular function, so no ataxia, but they will experience hearing loss with retinal dystrophy, and the visual loss from that retinal dystrophy will occur by the second decade, usually. Third type is progressive hearing loss plus vestibular ataxia. So this is like type 1 and type 2 combined. The retinal dystrophy can also be observed here. And lastly, type 4 describes deafness and intellectual deficits, which is a unique presentation of Usher syndrome. Before we move on, it will be prudent to know the anatomy of the retina. The fovea and the macula have the highest concentration of cones, and the light that converges here is what makes up our central vision. Optic disc is on the nasal part of the retina, and this is the point of exit for all the ganglion cell axons from the retina. Ironically, the light converge here cannot be interpreted in the brain, and thus forms a blind spot. Vessels of the retina, both the veins and the arteries, branch out from the optic disc and can be seen with the fundoscopy exam. There are a lot of different layers within the retina itself. Retinal nerve fiber layer contains the unmyelinated axons of the retinal ganglion cells. There are a lot of different nerve cells, such as ganglion, bipolar and horizontal cells as interneurons, and sensory cells known as photoreceptors. The plexiform layers contain the synapses between these cells and more, and retinal pigment epithelium is between the choroid and the photoreceptors and works to nourish the photoreceptors. Being autosomal recessive, the family history of Usher syndrome would be a significant risk of an individual of having Usher syndrome. The presentations of Usher syndrome includes the sensory neural hearing loss and gait disturbance leading to ataxia, and this is caused by vestibular dysfunction, retinal dystrophy upon fundus exam with retinitis pigmentosa. These will appear as dark pigmentary clumps on the retina. There will also be a decrease in the central vision in type 1 Ushers. Nyctalopia, which is an impairment of vision in the dark, will occur in childhood and early teens, and there will be dark adaptation problems that may be observed. Progressive constriction of visual fields will be observed over time, and cataracts may develop by age 40. Because of the vast symptomologies, some of the differentials can include non-syndromic hearing loss, Alport syndrome, which affects the glomerulus of the kidney, Bardet-Biedl syndrome, Friedreich's ataxia, and Kern-Sayer CPEO syndrome. So for patients with potential Usher, take complete ophthalmic history and attain a family history of hearing and eye disorders. Conduct a slit lamp eye exam with attention to refraction, pupils, cornea, lens, vitreous, and visual fields. Do a nystagmus assessment as well. And fundoscopy would be very important in this case, especially if the patient is complaining of progressive visual field restriction. Some investigations that's worthy in patients with potential Usher syndrome is electroretinogram and electrooculogram, plasma ornithine levels, and fat-soluble vitamin levels, the serum lipoprotein electrophoresis, lipid panel, and VDRL and FTA absorption for syphilis. Treatment of Usher syndrome includes hearing aids and cochlear implants. Vestibular manifestations can be corrected by supervised sports activities. Visual manifestations can be addressed by low vision aids and portable lighting. Supplements like vitamin A and luteins can help. Get a routine eye exam for low vision patients, and do a genetic counseling. Unfortunately, the retinitis pigmentosa from Usher syndrome will result in blindness by the patient's 40s, and therefore Usher syndrome has a pretty poor prognosis with regards to vision. So this is an earlier slide that describes the link between ophthalmology and ENT. Hopefully this presentation helped you understand the Usher syndrome as part of this link. And this is the summary chart of everything we talked about. And here is the reference I used to compile the information for Usher syndrome. Thank you for watching this video.